When the Fed announced its decision to buy $600 billion in government bonds over the next 8 months, it took most of us a while to figure out what that meant. But before one could even say quantitative easing, there was the Deficit Commission plan to talk about. Now the question is, will anything qualitative in real-life terms result? We'll talk to Dean Baker, co-director of the Center for Economic and Policy Research and author of False Prophets, Recovering from the Bubble Economy, next.
You hear about the Fed?
No, what about the Fed?
They announced another round of the quantitative easing.
What does that mean?
It means they are going to make large asset purchases via PAMO.
What does that mean?
It means they are going to expand their balance sheet and buy treasuries.
What does that mean?
It means they are going to print a ton of money.
So why do they call it the quantitative easing? Why don't they just call it the printing money?
Because the printing money is the last refuge of failed economic empires and banana republics, and the Fed doesn't want to admit this is their only idea.
Dean Baker, Grit TV economics correspondent. What does quantitative easing mean?
Well, printing money isn't that far from the truth there, but in terms of it being a failed policy, well, we're in a mess because of failed policy. Let's just put it that way. But quantitative easing, what that's about, we're buying long-term Treasury bonds, and the intention is to lower long-term interest rates, and they'll have some positive impact on the economy. So what we might reasonably hope is it lowers the rate on 10-year Treasuries 30 to 40 basis points, 3 to 4 tenths of a percentage point. Some of that will get passed through in lower mortgage interest rates, maybe 2 to 3 tenths of a percentage point. To some extent, businesses will be able to borrow more cheaply. So it has a modest impact on boosting the economy. It means some people will be able to refinance their mortgage or finance at a lower interest rate than would otherwise be the case, so they'll free up some money for consumption and some additional investment. It won't have a big impact. So what I'd say is, it's a positive. It's not a huge positive. By comparison, last year, the Fed had, this is called QE2, the second round of quantitative easing. During the first round, they had done about $1.7 trillion worth of purchases. So here we're looking at $600 billion. Last year, they had done about $1.7. It was helpful, helped bring down rates. This will probably not have as much of an effect. It's better than nothing. It's not going to get us back to where we should be, though.
Now, as I said, immediately following that news came the news of the initial plans from the Deficit Commission. Here's the media verdict on that plan, and we could have kept this montage playing for a very long time.
Is America ready for extreme economic shock therapy?
Shock therapy.
This is shock therapy here.
It's a report that has something in it to offend everyone.
Just about every American may feel the pain.
Pain is everywhere.
Shock therapy? Do we need shock therapy? And if so, who needs it? And is this really that?
Well, no. First off, we should be clear. It was not the commission. This was the two co-chairs of the commission, Erskine and former Senator Simpson. The commission itself has not issued its report, and we don't know if there'll be a report. So this is just the two co-chairs. And it is shock therapy. There'd be a lot of pain here. It talks about cutting Social Security benefits, cutting Medicare benefits. One of their proposals would get rid of the earned income tax credit for low-income people. So there's a lot of pain. But, the question obviously is, do we need this? Is this helpful? It's sort of like, if we had someone who was dying of cancer and we go, here's your exercise regimen. We want you to run 20 miles tomorrow. Well, that will be painful. It's probably not going to help them a lot in terms of dealing with their cancer, and it might well make it worse. And that's kind of the story here. We've had a lot of hyperboles about the deficit. The reality is we have a big deficit today because we had the crash of an $8 trillion housing bubble that threw the economy into a severe recession. Over the longer term, we're looking at a deficit problem because we have a healthcare system that's out of control. And the basic story is that if we fix our healthcare system, it's easy to show, if we fix our healthcare system so that our costs are in line with everyone else in the world, with Germany, with France, with Canada, whoever you want to compare us to, we don't have a deficit problem. Of course, if we don't fix our healthcare system, even if we zero out, we get rid of Medicare, Medicaid, the public sector programs, we won't be able to afford healthcare. The public sector will be fine, but the rest of us won't be able to pay for our healthcare. So it's really the wrong answer to not a problem.
The question, though, continues in my mind that we've been talking about all year, really 2 years, Dean, and that is, on the QE2 side, there's this discussion of keeping interest rates low so that businesses can get more loans, do more investing, hire more folks. But then with cuts like those that are being described, you're right, from the commission co-chairs, I don't see where people's wages are going to come from to buy stuff from any of these new companies that might expand because of low interest rates.
No, and this is what's really kind of infuriating. They're ignoring, they're acting as though there's this deficit crisis. And the reality is we have an employment crisis. We have 25 million people who are unemployed, underemployed, or given up looking for work altogether. And rather than talk about that, they're talking about this long-term problem with the deficit, which, as I say, really isn't a deficit problem. It's a healthcare problem. So even misrepresenting that. This is sort of like we've got the school on fire, and the kids are still in the school. And rather than talk about putting out the fire and rescuing the kids, they're saying, well, what color do we want to paint the classrooms when we rebuild? And it's close to wacky. I mean, and yet this is dominating public debate here. It is really off the wall.
You use the word kids. Ruth Marcus in the Washington Post said it was childlike to resist, and she was on the Sunday shows making the same point. Take a look.
You need to understand the scope of the problem before you can agree on solutions. Right now, 75% of people believe you could balance the budget without touching Medicare or Social Security. 75% of people believe that you can balance the budget without raising taxes. Well, you could, but it would be extraordinarily painful. People need to get a little bit of reality therapy.
Reality therapy, and she also used language like grow up. Is that our problem?
Well, it's the problem of people like herself and others at the Washington Post and Washington Elite. We have a calculator on our website, cepr.net, that allows people to pick any of the 34 countries that have longer life expectancies than the United States. And then it shows what the long-term budget situation would look like if per person healthcare costs were the same as in Germany, Canada, France, England, Denmark, whichever country you pick. And in every single case, instead of having huge budget deficits, we have huge budget surpluses. So this is really simple arithmetic. The point is that the reason we have a long-term budget problem, or projected to have one, is that we're projected to have a healthcare system that's out of control. So the answer should be fix healthcare.
Yeah, fix healthcare. Now, what about that commission? Do you really think they're going to give their recommendations and they're not going to be public? We're not going to hear the details?
Well, the issue is whether they get the agreed-upon consensus. The ground rules were that a report that got 14 of 18 votes was supposed to go to Congress. My guess is that they know, the co-chairs know they don't have 14 votes, which is why they preempted the whole commission and came out with their own report, which obviously got lots of attention. So basically, they broke the rules. That's the way things go here in Washington, and they got what they wanted. They got to set the agenda.
Does Obama have a clear strategy here?
Well, let me put it this way. If he does, he hasn't shared that with me. He can just say, well, this isn't his, he doesn't stand behind this, and these are interesting ideas, end of story. Or he could try to get behind them and really push Congress to act. I mean, it's not clear that Congress will act, but he could try to get behind it and really push.
Dean Baker from the Center for Economic Policy Research. You can get more information at their website, cepr.net, and try out that handy tool. And from ours, grittv.org. Thanks.